Since COVID-19 has hit, there's been a huge dip in preventative cancer screening. For colon cancer, for instance, it's been 84%, and for breast and cervical cancer, it's been 94%. We're here at MemorialCare at the Todd Cancer Institute, where we'll be having a special report with a panel talk of 3 doctors who can shed more light on the subject. Why is it important for you to still come in, especially in this time, and how safe do you feel and cared for at Memorial?
You know, I feel that it's very important for me to come in and have my mammograms done. Even though I'm almost 18 years out, it's even more important for me to have it checked out. And despite COVID, we still have to make sure that we're caring for our breast health. That is one of the most important things. It's easy to come here at Todd Cancer Institute because I feel safe here. You've got all the processes in place and the self-distancing and whatever, so it's easy. What they put in place makes it easy for anyone to come here and have their mammograms done.
And how safe do you feel as well coming in? How do you feel in terms of the cleanliness and procedure?
You know, by me being a cancer survivor and by me being a patient advocate, I watch them a lot, and they are constantly wiping down and making sure that the chairs are distanced and making sure that we're all separated from each other. They do an excellent job.
I'm joined here by Dr. Fabio Cappuccini, Dr. Nilesh Vora, and Dr. Angela C. Thank you so much for joining us here today to really talk to us about the preventative cancer screening issue that is being encountered in this time. So first of all, explain to us, Dr. Angela C., what's been going on in this time since COVID has hit with the preventative cancer screening?
Well, in middle of March, we stopped screening mammography at all of our breast centers in the abundance of caution. And we continued to see diagnostic patients, those with focal symptoms or who had specific issues that needed follow-up. And in early May, we started screening mammography again after taking significant steps to protect our patients and our staff from COVID-19.
Dr. Fabio Cappuccini, what has been the results of having halted the preventative cancer screenings? What are the challenges with that as well, and what does the population need to know in order to come in for their screenings?
Well, it's been that a lot of screening has been, as my colleague was saying, has been delayed of months, and now we have a backlog of patients that needs to be screened, and the clinics are not at full capacity yet because the limitations are very strong. So our worry is that there are a significant number of patients that will be lost probably to their screening because they missed their appointment and they won't catch up, and that could potentially, you know, translate into an increased number of cases, cancer cases, that maybe we will start to see, you know, in the future because of that. In my particular case, talking about, you know, cervical cancer, which we're screening from in my clinic, is not just a delayed on pap smear, but also for a very young subject, very young teenager women, you know, the vaccination for HPV, you know, which is the virus that causes the cervical cancer, is being delayed and could be a potential big problem.
We did touch upon the fact that because there's been this delay and letters are being sent out to remind people to come in for their screening. So Dr. Nilesh Vora, can you tell us as to what are the measures that MemorialCare is taking in order to ensure the safety and well-being of patients when they do come in? Because there's obviously a lot of concern coming into hospitals due to circumstances.
Yeah, it's a very good question, and I think I'd like to speak specifically about what Memorial has done. Almost from the get-go, Memorial took swift action in trying to prevent the transmission of this virus to patients. They did this by limiting visitors and screening at all entrances to every single clinic and every single hospital entrance on this campus. I think that's been really, really helpful. There's been reminders, calls to every single patient before they come in that if they have any symptoms that are suggestive of COVID-19, that they're not to come in. So that's been really, really helpful. And as I said, it was swift action to the point where I don't I don't recall there being any transmissions within the hospital from patient to patient, and very minimal transmissions from patient to healthcare providers. So it's really, it's a safe place. I really do feel that the hospital and the clinics are a safe place for our patients to come in and get their needed tests.
Well, it is a necessity, as you've been explaining. So the main cancers that we are touching upon are colon, breast, and cervical. So can each of you explain then exactly what are some of those symptoms that people do need to recognize? They may think they have a cancer, and what are some of the challenges of those symptoms that could be unnoticed? Let's start with you, Dr. Angela C.
Well, some breast cancers can present with symptoms such as palpable lump, focal pain, skin dimpling, skin thickening, spontaneous nipple discharge. But the smallest, most curable cancers are usually detected through screening mammography. And that's why we strongly encourage women to begin screening mammograms at age 40.
Okay. And Dr. Nileshwar, in terms of colon cancer?
Yeah, so with reference to colon cancer, and I'd like to echo what Dr. C said about being asymptomatic. I think there's two important thoughts on this. Number one is it becomes harder to cure a cancer when we find it late in its stage. And so the importance of screening tests come into play for this reason. And many times in an early stage colon cancer, there are no symptoms. And I think that's really important to understand. That's why these screening tests become so important to get done at the right time, at the right stage as is dictated by our guidelines. When colon cancer becomes more advanced, typical symptoms include rectal bleeding. So that's blood per rectum in the stool, whether it's red stool, maroon stool, or even black stools can be a sign of colon cancer. Other symptoms include weight loss, abdominal pain, pelvic pain. And again, those are all symptoms that occur as the cancer becomes more advanced.
And Dr. Fabio Cappuccini for
very,
cervical.
Very similarly, the most, typical symptoms of cervical cancer by the book are abnormal vaginal bleeding, especially after sexual intercourse, lower back pain, urinary tract infection, back leg pain, weight loss, anemia, but coughing up sputum tinged with blood. But those are all symptoms of very advanced stage 3 to 4 cervical cancer. When the cancer, of course, are very difficult to treat and especially difficult to cure. Early stage cervical cancer is practically asymptomatic. That is why a regular pap smear detects the disease at this preclinical stage, or give the physician and the patient an opportunity to catch the disease at a very early stage when it's very curable.
In terms of screening, what does that look like, and how often are you supposed to come in, and from what age?
Okay, every woman should be seen by a gynecologist at least annually, once a year, for their physical and pelvic examination and the pap smear. We suggest that for young women after the first sexual intercourse to start to have a regular gynecologic examination every year.
Okay. Dr. Nileshwar, how does that look like for colon?
Yeah, so guidelines currently say that colon cancer screening should start at the age of 50. And that the most effective method for screening is with a colonoscopy. There are other measures that have been hypothesized as being as effective. The Cologuard test, a sigmoidoscopy, a fecal occult blood test. These are all other methods that are sort of alternatives to colonoscopies. And I think it's important to have a discussion with your doctor about what the right method is. My personal recommendation is a colonoscopy every 10 years, starting at the age of 50, unless there's a family history that suggests that you should have a colonoscopy done 10 years younger than your first-degree relative with colon cancer.
Okay, thank you very much. And Dr. Angela C., how does that work for breast cancer?
Well, we advocate screening mammography annually beginning at the age of 40 for most women. certain women who have a significant family history or prior history of a high-risk biopsy lesion, and who have a calculated lifetime risk of breast cancer greater than 20%, we recommend annual mammography offset by annual breast MRI. So every 6 months, they're either getting the mammogram or the MRI. Also, there are other situations that warrant earlier screening mammography than 40, such as prior radiation to the chest, a first-degree relative who was diagnosed with breast cancer at age less than 40, and but in general, for the general population, we recommend annual screening mammography beginning at age 40.
Okay. Dr. Nileshvara, obviously we've heard in recent news 43-year-old actor Chadwick Boseman, who had passed away unfortunately from colon cancer. It was detected like 4 years ago, and he had been living through it for 4 years, not uttering a word about it, still continuing his life from what we have seen as is. Of course, behind closed doors, we do not know the suffering that goes on. So what kind of impact can that have on the body when you are suffering through colon cancer and still going through your life? And why, perhaps like so many others, did he not speak up about it?
Yeah, this is a really, really tough question. Mr. Boseman was diagnosed with colon cancer at a very young age, younger than the typical guidelines would ask to screen for colon cancer, as far as I know. And he represents one of the 5 to 10% of patients who have colon cancer that are diagnosed less than 50. And that's where our screening colonoscopies may not capture these patients so early. And then to your more important point is that the world didn't really know about his colon cancer. And as you said, he suffered in proverbial silence during this time period. And I think that's an interesting way to cope with cancer. There are two philosophies there that I've seen with patients. One is to not say anything to anyone because of reasons such as feeling like a burden to others, not wanting that negative attention, not wanting to put, the suffering on someone else and to glean that attention. I have patients who've come to me and said, I do not want my family to know about this because I don't want them to feel badly for me, and I don't want that. I have suggested to them that they incorporate their family into their battle. I just feel like having that support system ends up having much more of a positive impact than a negative impact. But I don't think it's a wrong way to cope with your cancer. I think every person will cope with their cancer individually. Having said that, I wish we had known about Mr. Boseman's battle, and I wish people with colon cancer would have seen all of the accolades that he achieved while suffering from and battling with this disease, because I think that would have led to a lot more hope and promise. I sort of parallel that situation, or I should say, I contrast that situation with that of Alex Trebek, right? And Alex Trebek has pancreatic cancer and has been very, very vocal about the battle that he's having. And he's inspired a lot of my patients to keep trying and keep battling because he's been a role model and he's still alive to think about it and talk about it and voice his opinion and bring positive exposure. So it's difficult to answer your question. I can understand why Mr. Boseman took the approach that he did, but I can also understand why patients want to incorporate other people who represent positive impacts into their battle.
Mm-hmm. I mean, as I understand, you do offer palliative care over here as well, because there is a lot of emotional, financial, physical burden that person might be feeling, and everybody has a different way of dealing with it. Well, we want to know some of the advanced treatments that MemorialCare offers for each of these cancers, starting with you, Dr. Fabio Cappuccini.
Well, for cervical cancer, in the early stages, it's treated with surgery, and the surgery is the surgery for cervical cancer has been, standard now of care for many years. What is completely different is the treatment of advanced stage cervical cancer, for which now we have been using, for example, immunotherapy in various forms or novel pharmaceutical. We are expecting the FDA to register, and to include in the clinical, care 4 new medication for the next year, just for cervical cancer, and that will be a very fast approval. Very great progress have been in the treatment with radiation therapy for cervical cancer. New modality of radiation. Over here, for example, we use this method of inserting needle directly into the tumor, okay, of the patient. These needles are connected with a generator of very high source of radiation therapy that just bring the radiation inside the tumor instead of to give radiation only from outside the body. Is one of the few centers in the United States where this is possible. And the radiation therapist thread the needle and we open the abdomen and we direct them completely inside the uterus and the space around the uterus and the cervix. So that is pretty advanced and pretty sophisticated.
Wow, it's incredible. Okay, well, Dr. Nilesh Vora, how about in the colon cancer area? What kind of advanced treatments are being offered here at MemorialCare?
Yeah, so I'm really, really proud of our colon cancer program here at Long Beach Memorial. Starting with screening, we have a really tremendous GI team performing screening colonoscopies on a timely basis. Moving on to diagnosis, one of our greatest assets here is our tumor board. We have a multidisciplinary tumor board that meets every 2 weeks, and all of our challenging cases of colon cancer and rectal cancer are presented at tumor board, where different disciplines, so a surgeon, a radiologist, a pathologist, an oncologist, radiation oncologist are all present, along with palliative care and some of the supportive needs. So each patient gets kind of an individualized opinion about their particular disease. So I'm extremely proud of our GI tumor board. And then moving on to surgeries, we have some of the best surgical techniques here involving robotic surgeries, laparoscopic surgeries, so that patients don't suffer from very large surgical procedures. If indicated, they can stay in the hospital for just a minimal amount of time before going home and being able to recover at home. And then with regards to treatment, our pathologists do a really outstanding job of defining the tumor, individualizing the tumor so that we can pick the right chemotherapeutic options. And then now there's an emergence, as Dr. Cappuccini said, of immunotherapy in colon cancer, specific types of colon cancer that seem to respond to immunotherapy are being looked for. And then finally, the idea of clinical trials, which we are establishing here at Long Beach Memorial, again, for those patients who have really difficult to treat colon cancers, giving them more options for care.
Okay, seems like you have a lot happening here. Dr. Angela C., how about in the realm of breast cancer? What kind of advanced treatments can we find there?
Well, first of all, to find small breast cancers, we need the most advanced technology, which we have here. We have 3D mammography and the most state-of-the-art ultrasound machines. And so we're able to find very small breast cancers that are more curable than more advanced ones. And we're also able to have less callbacks, unnecessary callbacks from screening exams. So we're very lucky that we have the most advanced technology here. For the cancers that we do find, we really have a treatment here at Long Beach Memorial because we, like Dr. Vora mentioned, we have a very multidisciplinary approach. And for instance, our radiation oncologists are able to, in certain patients, offer intraoperative radiation therapy. Instead of going through a whole 6-week course of radiation therapy, they're offered it similar to the way that Dr. Cappuccini described, in the operating room, one shot. Also, our subspecialized breast surgeons use a special oncoplastic technique when they do a lumpectomy for the most advanced cosmetic result, the best cosmetic result. So, basically our surgeons, oncologists, radiation oncologists, and our support staff were able to offer really a multidisciplinary approach second to none in the area.
Wow, that sounds truly incredible. Well, thank you so much, each of you, for your time and for all the work that you do.
Thank you.
So as you have seen and heard, it is still so vital, especially in this time, to be able to come in for your preventative cancer screening. There's no fears. MemorialCare is taking great measures to ensure the safety and well-being of patients, as well as offering advanced treatments. For more local news here in Long Beach, head on over to longbeachlocalnews.com. I'm Yasmin Tanres.